Well, as the Bahamas continues to record double digits increases in COVID-19 cases, Health Minister the Honorable Ranwood Wells is defending the timely distribution of related data. With health personnel also among the casualties, health officials say the process for managing and reporting information has been compounded by rising numbers.
I have been Minister of Health now for 18 days, and I've seen no evidence, none whatsoever, that health is holding information from the general public.
Health Minister Ranwood Wells defending the ministry against criticism that health officials were withholding information on the number of patients and health officials impacted by COVID-19. Minister Wells explained the approach taken in reporting.
I think the first response of health is to assess the situation, understand what is going on, seek to do the contact tracing, get the requisite information first. In responding to it, and in the process of responding to it, then the information is given to the wider public as to what the Ministry of Health is doing in that response. And a part of that response would be, here's an institution where we have positive patients, and here's what we're saying in regards to you coming to that institution, whether you should come to that institution or not come to that institution. And that is what the Ministry of Health has been doing.
Chief Medical Officer Dr. Pearl McMillan says the healthcare system capacity is challenged to respond to the steep rise in cases and persons under investigation. She speaks to personnel affected in this latest wave.
We notice that 30 healthcare so far are positive, COVID positive. This has exceeded, and this is just for the second wave, this 30 has exceeded the number that we had in the first wave. All public health care facilities, inclusive of the Princess Margaret Hospital, Sandilands Rehabilitation Center, community clinics throughout New Providence, and the Rand Memorial have been impacted.
Meantime, hospital administrator Mary Walker was asked about the supply and distribution of personal protective equipment to health personnel who have criticized the availability as inadequate.
Burn rate locally within this country has been calculated for our healthcare workers. A closer look at the inventory, which we present in each meeting every day within the EOC, indicates that on average, we are in a position of having at least anywhere from 15 to 43 weeks of certain items in our inventory. So given the rate that we're having of persons that are hospitalized, we are in a very good position at this point in time based on our calculated burn rates that we do have the supplies in country to meet our needs at this time.